My name is Dr. Garth Sliz, and this is the ECG diagnosis of atrial fibrillation. As always, we begin our interpretation with analysis of the P waves, but unfortunately, in patients with atrial fibrillation, there's no distinct depolarization from the SA node down to the AV node. Instead, what happens is a random depolarization throughout the atria, which causes depolarization in multiple directions. These depolarizations sum up to give a flat, erratic line with no P waves to be found at all. So let's look at the inferior leads, leads 2, 3, and AVF, where we would normally want to see a nice P wave from regular depolarization, but instead we see no P waves, and that is the first clue to atrial fibrillation. We find the second clue when we check the regularity of the depolarization. And what we find there is an irregular RR intervals. In other words, no RR interval is the same. There's no pattern, no regularity of those intervals, which means it's a random summation of depolarization. And with no P waves and random RR intervals, then we can add those two together to diagnose atrial fibrillation.